On this Monday night, holiday plans upended by Omicron. With an explosion of cases expected soon, Quebec is reimposing restrictions right now.
As a business owner, it's depressing. It sucks.
And the rush for rapid tests.
Now they're going through the Hunger Games rapid test edition.
Fresh fears for long-term care homes.
We still don't have a fully boosted population of residents and staff.
From vaccine boosters to Omicron symptoms, we're putting your COVID questions straight to the experts. A critical BC artery gets the green light, the reopening and the relief. Plus, rebuilding an ancient Roman city.
And we don't know how it looked like.
How Pompeii's ruins are being reconstructed by a robot.
Global National with Donna Friesen. Reporting tonight, Jeff Semple.
Good evening and thank you for joining us. Provinces are scrambling tonight to reimpose restrictions, with COVID-19 cases climbing to new heights, driven in part by that highly transmissible Omicron variant. Nationally, Quebec is the hot spot, hitting a new single-day record with more than 4,500 cases reported today. Most of those infections are in people who are double vaccinated. The province is also seeing a jump in hospitalizations, up 21 today, with 3 more deaths reported. The Quebec government is taking drastic action tonight, imposing new widespread restrictions. Quebec's health minister says the situation is critical.
I know the situation is tough, but now is the time again not to get discouraged, to be strong. I ask everyone to be part of the effort again. It can make all the difference.
Quebec is not the only province taking steps to try to slow the spread of Omicron. Mike Drolet has more on Canada's fight to contain the new variant in our top story tonight.
Quebecers have been down the restriction road before. They know it's a bumpy ride. But changing the rules mere hours after they went into effect, the province's top health officials seemed as stunned as everyone else.
As we say in French, du jamais vu. This is unbelievable.
The new measures include a mandatory work-from-home order for offices. Bars, casinos, theaters, and gyms will be closed, and restaurants can only open between 5 and 10 p.m. with reduced capacity. The owners of this Montreal restaurant saw the writing on the wall and shut down yesterday. They feared it was only a matter of time before someone on their staff got infected.
As a business owner, it's depressing. It sucks. There's nothing we can do about it. All we can think of is the safety of our staff, the safety of our children.
Quebec has been hardest hit by the Omicron variant, but can the rest of the country be far behind? Ontario, BC, and Newfoundland have put some measures in place, limiting indoor capacity in restaurants and bars and applying footloose rules to big parties, meaning no singing and dancing. In Toronto, residents had already begun limiting numbers for dinner.
2. It was going to be about 15, and then we canceled it.
Ontario saw long, frustrated lines of people waiting for booster shots after they were made available to anyone 18 and older, just days after exhausting a large supply of free antigen tests in only a few hours. Most everybody, it appears, is desperate to avoid another lockdown, even though doctors say we haven't hit Omicron's peak.
Based on what we're seeing in Europe, there will be a large number of cases over the next 2 to 3 weeks.
And what happens next may depend less on numbers and more on the ability of hospital ICUs to keep up. Mike Drolet, Global News, Toronto.
Canada's Minister of Foreign Affairs has tested positive for COVID-19. Melanie Joly made the announcement on Twitter, saying she's in isolation after getting a rapid test result. She says she's now awaiting the result of a PCR test. Joly is encouraging Canadians to limit contacts and follow public health guidelines. Soaring cases have sparked a rush across Canada for those rapid antigen tests. Many people are hoping the self-test kits can provide an extra layer of security to help keep their families safe, especially over the holidays. But as Mike Le Couteur explains, those rules and recommendations for rapid tests depend on where you live.
Day 1 of the rollout of rapid tests in Quebec started early and ended just as quickly. People lined up in the freezing cold just to get their hands on a pack of 5. I was expecting a lineup, but not like this, said this woman. Minutes later, relief from another customer. Pop-up distribution sites have been set up across Ontario with similar scenes. This line snaking around Union Station in Toronto, underscoring the scarcity of supplies.
The people of Ontario have already gone through the Hunger Games Vaccine Edition, and now they're going through the Hunger Games Rapid Test Edition. It's simply not fair.
Meanwhile, in BC, rapid antigen tests still aren't widely available to the public, and it's frustrating some frontline healthcare workers.
We have been sitting on these tests here in British Columbia for over a year now, and I do not understand why now we are in a bit of a panic and the public is just asking for these, why we haven't been more proactive.
The frustration is coupled with confusion over when to use a rapid antigen test. Quebecers are being told to use one if they have COVID-19 symptoms, but in Ontario, you're supposed to use one if you don't have symptoms.
Appreciating that we're in the middle of a pandemic, the Omicron wave, things are dynamic, they're changing all the time, but crisp, clear communication is what Canadians need right now.
While a spike in cases of the Omicron variant have caused a run on rapid tests across the country, public health experts warn they are not the gold standard PCR test. Adding masking and social distancing remain important.
A negative rapid test can't be used as a license to go out and be reckless and disregard all public health measures. But if we use them in conjunction with everything else, they can be very useful and they can help.
Especially if people want that extra peace of mind over the holidays. Mike Le Couteur, Global News, Ottawa.
The emergence of Omicron is forcing many Canadians to rethink their holiday plans. Difficult decisions over whether to visit friends and family are even more poignant for people with loved ones in long-term care. As Jamie Mauracher explains, the climbing COVID caseload is prompting a familiar warning.
There's some signs it's Christmas, but Paul Hartford isn't in the holiday mood. He lost his brother and had to put his father Leo into long-term care. Now, thanks to COVID, he says this could be the first year in 71 years his parents spend the holidays apart.
I don't know what signing my father out to take him to the farm to visit my mom and my sister-in-law, I don't know if that's going to be allowed. And if it is, I don't know what that looks like.
In the face of the highly contagious Omicron, Ontario restricted long-term care residents from going on overnights. Provinces were forced to move quickly to limit the number of visitors, and some even put mandatory vaccine rules in place. Precautions experts say we need because we didn't get boosters into arms quickly enough.
I'm actually very terrified about what's facing our long-term care facilities, and really, the major fear is that so many of the frontline staff have not received their third doses.
86% of long-term care residents in Ontario are vaccinated, but just 37% of staff have their third dose. Doctors say the rates are likely similar countrywide.
Just imagine, you have an outbreak, staff have to isolate, we don't have enough staff to replace them. All of a sudden, it's not just about the risk of dying from COVID, but we know that when you don't have enough staff to even provide the basic care that people need, that's when everything starts to fall apart.
During the pandemic's first wave, some seniors were left alone in their rooms with devastating outcomes. Advocates say isolation isn't just dangerous for physical health, but residents' mental health too.
It was the most devastating thing that could have possibly happened for vulnerable, lonely seniors.
They're isolated in their rooms, all meals in rooms.
It's part of the reason Debbie Marsden will be taking her mother home for the holidays.
We don't know when we'll be able to return them because of the restrictions, so we're taking a risk.
Paul understands the need for restrictions. He worked in health and safety for decades. Still, it hurts him to know how much his mother will miss her husband.
I hate seeing her pain. And that's the hardest part for me, is seeing her pain.
Torn between keeping everyone safe and bringing them together when they aren't certain how many holidays are left. Jamie Mauracher, Global News, Toronto.
To other news now, and the federal government has announced a $28 million plan to help PEI potato farmers who've been hit by a trade suspension with the United States.
Beside facilitating additional processing, this funding will be used to support the diversion of surplus potatoes by redirecting surplus potatoes to food banks and other food aid organizations.
The Agriculture Minister also said the money will help cover the cost of disposing of the remaining crop in an eco-friendly way. Exports of fresh PEI potatoes to the U.S. were halted last month after the discovery of a potato wart in the province. It was first located in 2 fields back in October. The trade suspension has cost farmers millions in lost revenue. Well, to some much-needed good news now in British Columbia. The Coquihalla Highway finally reopened to commercial traffic today, weeks after extreme weather destroyed parts of the pivotal route with floods and landslides. Crews are still busy repairing the critical connection, but news of its reopening is welcome relief to truckers and BC's supply chain. Global's John Waugh is on the Coquihalla near Hope, BC tonight. John.
Well, Jeff, it's pretty remarkable to think that just over a month ago, the Coquihalla Highway was literally torn to pieces in 20 different places. Now, you can still see evidence on one side of me where both lanes were washed out and are being rebuilt as we speak. But on the other side, commercial traffic is once again moving freely on this crucial supply route that connects BC with the rest of the country. Many drivers know it as British Columbia's highway through hell.
So hopefully we don't have to chain up.
Now truckers are calling the Coquihalla a beacon of hope.
I'm kind of excited for it to be open. I didn't know it was going to open so soon.
I mean, it's a main link. You can't get through without that one.
Barely a month after the 543-kilometer highway was ripped apart in multiple places by atmospheric rivers and flooding, this critical supply route connecting BC to the rest of Canada is open once again.
The only thing that could bring the Coquihalla back was the sheer force of will of the road building community for 31 days straight, round the clock, to get this to happen.
It didn't take long for important goods and supplies to hit the reopened road, which normally sees on average 4,000 trucks a day.
You really can't overstate the importance of the Coquihalla in terms of how it connects the Lower Mainland and the Port of Vancouver and all those things that we take for granted to the rest of the country.
For truck driver Len Kimmer, seeing the patchwork of fixes firsthand, offering hope for a province trying to rebuild.
Make everything a little safer and everything move a little better. All the good.
Now, BC's Ministry of Transportation reiterated the fact that this is not the old Coquihalla Highway and these are just temporary fixes. When it comes to building the highway back better, including climate adaptations, well, the work to figure out those overall costs and timelines has only just begun. Jeff?
John Waugh reporting near Hope, BC. Thanks, John. A Chinese tennis star speaks out. Coming up, what Peng Shuai is saying about that sexual assault allegation leveled at a high-ranking Chinese official. Plus, the aftermath of a devastating storm in the Philippines. Well, there is grim news tonight out of the Philippines. The number of people confirmed killed by a powerful storm has jumped to more than 375. Super Typhoon Rai hit the country last Thursday, officials describing the aftermath as complete carnage. International charities are now appealing for donations to help with urgent relief efforts. Chinese tennis star Peng Shuai says a social media post that appeared to include an allegation of sexual assault was misunderstood. Last month, Shuai appeared to accuse a high-ranking Chinese politician of sexually assaulting her in the past. Following her post, she wasn't seen in public for nearly 3 weeks, prompting concerns about her safety. In an interview with a media outlet in Singapore, the 35-year-old now says she was not harmed and that she's been living at home in Beijing. The Women's Tennis Association is still calling for a full, transparent investigation. Canada is among several countries expressing grave concern over the results of this weekend's election in Hong Kong. Because of new rules imposed by China, only pro-Beijing candidates were allowed to run for government. That resulted in a turnout of just 30%, the lowest since the British handed Hong Kong over to China in 1997. In a joint statement, Canada and 4 other countries say the changes have undermined the territory's rights while eroding the democratic process. From symptoms to spread, we're answering your questions about COVID-19, Omicron, and the holidays next. Welcome back. Moderna says its booster shot appears to significantly increase protection against the Omicron variant. The pharmaceutical company says an additional half dose of its vaccine saw a 37-fold increase in antibody levels. A full dose led to an 83-fold increase. Both produced side effects comparable to those seen after the first 2 doses. Now, these lab results are preliminary and will now undergo a full scientific review. The Omicron variant and the prospect of another COVID Christmas are prompting plenty of questions from viewers. And to answer some of those, we are joined now by Dr. Anna Banerji, who's an infectious disease specialist with the University of Toronto. Dr. Banerji, thanks so much for joining us. You know, we've heard that news about Moderna and the effectiveness of its booster shot. So the first question for you comes from Erna Jean, who says that my first 2 vaccinations were AstraZeneca, then she had the Pfizer shot 6 months later. Does it matter what booster shots she receives?
So basically, I consider Pfizer and Moderna like Crest and Colgate. They're basically the same. The buffers are slightly different, but they work in the same way. So right now, either of the messenger RNA vaccines are fine.
Okay. Next question comes from Dale, who says that the vaccines that we're currently using are for the earlier COVID variants. Of course, that's what they were designed for initially. But now we have a new variant. Do we need to start trying to make a new vaccine altogether?
I think that there's some controversy. I mean, if you listen to Dr. Fauci in the States, he'll say, you know, it seems to work. And recently the booster, as you said, for Moderna, seems to cause a good immune response. But some of us are wondering, you know, if the vaccine was designed for the original Alpha variant, maybe it's time to look at updating the vaccine, especially if it looks like, you know, with 2 shots, the effectiveness is going down until you get boosted. So I think that's a question that we'll have in the future, especially as mutations occur, like the influenza vaccine. Maybe it needs to be updated.
Yeah, and we have heard, of course, from Moderna and Pfizer, both with plans to develop new vaccines to better match the Omicron variant if needed. Next question for you comes from Karen, who asks, what are the symptoms you feel if you test positive for the Omicron variant?
Well, it depends. It depends on many different things. It depends on how old you are, what your immune status is like, if you've been vaccinated or not. From what I understand, Omicron is similar to Delta, and so you can have symptoms all the way from no symptoms, just a mild runny nose, cold-like symptoms, all the way to more serious symptoms. The more serious symptoms are, you know, if someone's not vaccinated or someone's compromised, and so they couldn't, you know, take the vaccine as well. So it really depends on many circumstances.
Okay, next question comes from Pat, asking about transmissibility. So wondering if the Omicron variant is more transmissible when we touch surfaces, for example, or is it mostly airborne spread? What do you think?
So there's been some controversy over this over the years, and I've thought almost from the very beginning that COVID was airborne. And now more and more people are saying that it's airborne. So it's really not, you know, touching surfaces, even though you can get viruses that way through droplet spread if someone's coughing or sneezing. But a lot of people are saying that's really through these small particles that linger in the air for a while. And so, and that might impact, you know, ventilation systems, the kind of mask we wear. But I think that we're thinking that it's more airborne than from touch. Last year, people were worried about grocery bags and shopping carts, and I really think it's more the air that we're concerned about.
Dr. Anna Banerji, an infectious disease specialist from the University of Toronto. Thanks so much for tackling some of those questions for us. Really appreciate it.
My pleasure. Thank you.
And we will be putting questions about Omicron straight to the experts all week. So please send us yours to yourquestions@globalnews.ca. Next, the robots repairing history at the site of an infamous volcanic disaster. Many families will spend part of their holidays crouching over jigsaw puzzles, working to piece together a bigger picture. Well, that activity is a year-round occupation for archaeologists whose job can involve painstakingly reassembling ancient ruins and artwork. In Italy, researchers have come up with a new way to reconstruct ancient ruins. Redmond Shannon explains.
The eruption of Mount Vesuvius in 79 AD was both horrific and historic. It froze the city of Pompeii in time until excavations began in the 1700s. Since then, many of the ruins and colourful frescoes have crumbled, thanks to careless excavations, rainfall, clumsy tourists, and even Second World War bombings. Putting them back together is hugely time-consuming.
It also doesn't increase the knowledge or the understanding or the expertise of the archaeologists, of the conservators. It's just putting the pieces together. The real work for the archaeologists comes after that.
So researchers in Italy are planning to 3D scan every single piece of some frescoes and use artificial intelligence and robots to put them back together.
We have also to take into consideration there could be parts of the drawing that is over the fresco that are not visible easily. So we will use this type of technology to investigate what could have been there.
In 2010, the Gladiators Barracks collapsed. Photos can be used like the cover of a jigsaw puzzle box to help with reconstruction. But with the so-called House of the Lovers hit by Allied bombs in 1943, AI will have to work harder.
Because we do not have the box and we don't know how it looked like in the past.
The project aims to help everyone in archaeology focus on research instead of puzzle solving.
But if our system works, then we can export that technology and we will be able to reconstruct frescoes that nowadays are just stored into storerooms.
The project is expected to take 4 years, but that's only the blink of an eye for patient historians. Redmond Shannon, Global News, London.
And that is Global National for this Monday night. I'm Jeff Semple. Tonight's Your Canada is this month's big truck parade in downtown Campbell River, BC. We love seeing Your Canada, so please keep sending us your festive photos to viewers at globalnational.com. Thanks for watching. Hope to see you back here again tomorrow. Have a great night.